All right. Good evening, everybody. Thank you so much for being here. I'm just super excited to share with you Skin Revitalized at Valley Vital Medicine. I'm Trevor. I'm a nurse practitioner here. Started Valley Vital Medicine just a little over 5 years ago, and it's been an amazing journey since then. And I'll introduce myself a little bit more here in a second, but I'll let Kira introduce herself to you real quick because she is my co-host tonight, and she's one of our nurses here at Valley Vital Medicine. So Kira, why don't you introduce yourself real quick?
Hello, everybody. I am Kira. I am one of the nurses here. I have been with Valley Vital Medicine since 2021, and I'm just excited. Trevor came to us a couple months ago and asked if some of us nurses would be interested in onboarding some aesthetic treatments, and we were really excited to hear how it fit into Valley Vital Medicine's um, what their goals are and what we're just excited to do as far as lining with the vision of Valley Vital Medicine and aesthetics. So that is what I'm excited to share, what we've learned, and maybe how we can meet some of your goals. So that's kind of the goal for tonight.
Absolutely. Thank you so much for sharing, and you'll hear a lot more from Kira here in just a little bit. I just want you to know as well that there is a Q&A available in the sidebar for this webinar. So encourage you to use that along the way as we go. Let us know what questions you have, and then we will come in at the end and make sure that all of your questions are answered. So, all right, let's go ahead and get this started. So, little disclaimer here. So, this information is educational tonight only. We are not making any medical diagnosis. We are not giving any treatment advice to you tonight. This is truly information for you to help to determine, for yourself if you think that this any of these aesthetic procedures might eventually be a good fit for you. So, please read that disclaimer. And here we go. So Valley Vital Medicine. So I'm Trevor Hausauer. I'm a family nurse practitioner here at Valley Vital Medicine. I started this practice here about 5 years ago, as I said earlier. And really my goal was to give people a place to be able to come where they could dig into the root causes and figure out why it is that they don't feel well. And, conventional medicine really, it has an amazing role to play. And that role to play really is primarily in acute care and surgery, the things that, we just need for those circumstances where things just oftentimes go wrong in life. But when it comes to chronic disease, it really is the role of functional medicine where we can come in and we can look at diet, we can look at lifestyle, we can individualize things for each individual person to help optimize their health. And, we do a lot of things here when it comes down to digestive health, when it comes down to detoxification. And those things have a real role to play when it comes to skin health. And we have seen some really, really cool results in regard to helping people's acne to go away and decreasing redness in the skin. However, there were some cases in some of the individuals that we're working with where they had, say, scarring in their cheeks, or maybe a little bit of rosacea or sun damage that might put them at a predisposed risk for skin cancer in the future. And so one of the things that I wanted to do with the Skin Revitalize is be able to bring in some technology and a real kind of unique and advanced way of thinking to help people to be able to take their health and their skin health in particular to that next level. Another thing that was really, really concerning to me is that even though we were approaching people's health in a very, shall we say, natural way, many of my clients were coming to us and they were doing Botox and fillers and some of these other things that really, frankly, had me significantly concerned regarding, is this something that's really safe for them to be doing? And also the fact that Botox and fillers oftentimes are leaving people with skin that doesn't move. And that frankly just isn't natural. And oftentimes people are looking like they're plastic, or that they don't they're not aging well. You know, there's a real great sometimes short-term results when it comes to Botox. However, if people want to keep it up, they need to do it regularly over and over and over again. But also the name Botox itself to me was concerning. It's a toxin. So is that something we want to continue to use on a regular basis? So I did a little bit more research. I did a little bit more education. We're going to learn a little bit more about that tonight regarding, is this something that we really want to be continuing to use on a regular basis? So as we're working on health on the root cause, how do we take care of our skin at a higher level that's going to help us to be able to really look and age well, and also be at a lower risk for skin cancer and those kinds of things? So at Valley Vital Medicine, we offer a lot of different services between lab services. We do ozone therapy, we do IV vitamin therapy, soft wave, we do pain evaluations, neurofeedback. We have a Hawkett sauna, but really tonight is all about the aesthetics. And so that's where we're going to focus on at this point. Okay. So I talked about this already. We are really looking to work on the entire person. The skin is one of the biggest organs that we have. And really, if your skin doesn't look good and you look in the mirror, ultimately people can have uncertainty about themselves. And so we want to be able to come alongside them, help to support them along that journey. So our goal really is to help you look and feel the best that you can at the age that you are, and age well. So there are some beauty bombs that I want to share with you, because frankly, they are very, very important. So give me 1 second here as I get these loaded up. So all right, so this video here is from Dr. Diane Kaiser, and she makes some really, really incredible points here about beauty and health. So
beauty bomb number 1, Botox. Botox is something that we're seeing a lot of people behind closed doors. Are you guys seeing this with your patients or clients, that people are doing Botox and they come to you really damaged and toxic? Yeah, I'm not seeing that many hands. Yeah, okay. I really want to know this because a lot of people don't know that that's what caused their issue. Because with Botox, they can have systemic and histamine reactions that could last it can happen in the moment of injection. It can happen 3 months, 6 months, 1 year, 10 years down, or not 10 years, 2 years down the road. 2 to 3 is where we found it starts to finally wear off. And the reason for that is that you could easily become a certified injector paying $600 for a 2-day training. You don't have to be a doctor. I think you guys probably know some of that. In fact, within the last week, they just seized 70 boxes filled with Botox and fillers that were coming from other countries, not just China, but places like Germany as well. And they were on their way to the States, equivalent to about $250,000 worth of treatments. And they were off-label. So what's in these things? Can we really trust them? And here we are as health practitioners. And I want you to ask yourself about your own hypocrisy. This is where I had to face my own demons, my own shadow. So here I was talking about, get plastic out of your life. No BPA. BPA is bad, right? No Tupperware, no plastic forks. Yet I had the most toxic thing in my body, which was breast implants. How about plastic surgery? Cleaning everybody's routine out, doing labs to check for BPA. Yet here I was. Self-betrayal. Self-betrayal. Your soul doesn't forget that. Your body keeps the score. And Botox as well. So over 2/3 of Botox in the US is considered off-label. In other words, it's not approved by the FDA for the uses that they're injecting it for. In the last month or so, I noticed that these new trends. What can we do with Botox? Let's use it on men. Let's call it Scrotox for their scrotum. What? But then, I'm not even joking. They're using it to have less wrinkles in their scrotum. I mean, what can go wrong? Infertility. transhumanism. And they also have one, if you're gonna get a blowout, a Brazilian blowout, they have one called Botox. That could go in another direction as well. And that's so that it'll maintain longer, so your dew will last longer. It's wild. I mean, we're also seeing this now that a lot of parents are bringing their child in who have extreme constipation. Guess what they're giving them? Botox. Yay, Botox for everybody. It's disgusting. I get really angry about it, but we could laugh right now, but these are the questions that we need to ask our patients. This needs to be on your intake form. Have you had Botox now or ever? They're not associating the symptoms that they come in to see you with this war poison, and the same thing with fillers. So a lot of people also don't know that fillers are considered devices. They're permanent. So these fillers, all the different things that you guys might be using and thinking, I look younger, it is actually considered an implantable device. And I'm gonna show you guys some symptoms of all implants, including fillers. So Botox crosses a blood-brain barrier. Maybe some of you guys know that. It kills nerves permanently. Permanently. You can take breast implants out, but you can't take the Botox nerves and repair them. Your body has to build new nerves. So it's pretty wild. This is where we're seeing people looking a little bit, shall I say, clowny as they get older, because they lose the use of those nerves. And it's pretty depressing. So I'll try to be more funny. I'm sweating. Does anybody have any Botox I could put on my armpits? Who's done that? That's wild. This is what people are doing, and they're not associating that with their medical history and the now symptoms. Okay, so I'm gonna keep going on this. Migraines, you guys know how to treat migraines. I mean, we've got so many great products and different hacks. All right, you might have also heard the gaslighting from some of these injectors. Oh, it's just anxiety. Or like you already had symptoms before, it just got worse because maybe you didn't sleep well last night. So there's a lot of this happening. I know you guys know nothing about this from the patients that you're working with and the doctors that they work with before that. How toxic is Botox?
The thing about Botox is it's the most dangerous toxin known to mankind. It was classified as a biological war material. Medical studies have proved that the toxin does spread, and not only that, but it crosses the blood-brain barrier. So once it's in your brain, it causes neurological damage. The paralyzing effect of Botox is so bad because if it escapes from the injection site, it can paralyze anything. It can paralyze your gut, it can paralyze your bladder, it can paralyze your heart, which of course would cause a cardiac arrest. And most dangerously, it can paralyze your lungs. Why would you want to inject something like that into your body? There are more and more medical studies coming out proving that this toxin is extremely bad for the body. Once you have been through the living hell of Botox illness, you will understand just how bad it is.
I don't want any of you or your clients or patients to ever have to experience what a group of people in a Facebook forum are talking about on a daily basis. I have patients who have come to me in privacy wanting to kill themselves. And this is not just average once in a while. This is very, very common. I had 5 nightmare cases last week, and one of them was Botox. So it would actually take about a 2.2 gram dumbbell to be released on the entire human race and kill us by inhalation. No big deal. Now, we've already known from all of the vaccine, the vaccine that's another bioweapon, and a lot of people who don't know how to report. The same thing goes to be true with Botox. So I highly recommend that if you guys have patients that have this happening, please report it, but that multiple of 10, right? If we can see that just this year, or last year, 60,000 total cases of adverse events, close to 9,000 serious ones, 900 death cases, we can multiply that by 10 to see that we have 6 million total cases, 900,000 or so serious cases, and 90,000 death cases. So please report these things. And you can see the same thing with fillers. Go on the FDA site and actually see what other people are experiencing. I read this article first in 2019 when I was doing all this research. And what I found was this was a 15-page article. I went to go get it for today, or for presentation today, and it was 3 pages. And I went, oh, I'm gonna go on the way back, right? You guys use that? Go on the way back and find out if there's previous articles? Nope. Even the older ones only had 3 pages. They're wiping this stuff off of the internet. So if you see good stuff, screenshot it because you might lose it. So symptoms of Gulf War syndrome are nearly identical to Botox, to botulinum poisoning. And you'll also see on the website, on the BotoxCosmetic.com website, that there's not been any confirmed serious cases of spread of toxin, but you'll also see these cases of $18 million lawsuits. So it's a little bit of hypocrisy of what we're gonna see. The black label wasn't introduced until 2009. It does confirm that the toxin spreads. Even though, think about when you went to your injector, did they tell you that? Did we ask? Did they even know? They're being beauty brainwashed as well. So, talk about politics. We have Putin gets Botox too. So, Botox, they've done studies on this and they found that Botox removes empathy, or at least starts to reduce it. So, it freezes our face when you think about it. Our brain can't register emotions. It does cross the blood-brain barrier. It interferes and blocks with neurotransmitters and your HPA axis. So if it's affecting our HPA axis, how much do you think it's affecting our hormones? This is a study that I'll leave for you guys to research on your own, but it's proving that it does cause thyroid autoimmune disease. And I overcame mine, but it took some time. And those Botox illness symptoms there is something that went pretty viral when I created it, because a lot of people didn't know it at the time when I started sharing this. So fillers is beauty bomb number 2, and I gotta start flying through these. Fillers actually are something that has not really been regulated. I always like to say, do not use something unless it's been on the market and used for at least 7 years, because they don't have long-term studies on any of these things. So the myth of the fillers is that the body eventually breaks down and it will just dissolve on its own, but it does not. It will migrate, and you have to have it broken down with a magic eraser. So it lasts from 6 to 18 months is what we've heard, but I wanted to flip through this video so you can see the truth. Oh wait, hold on, I gotta go back and then you guys cue the video. That's not what was supposed to happen at all. I didn't hit a button. I don't know what happened. I didn't hit anything. You guys gonna play the video? I can't even see my slides right now on the screen. Something happened. All right, I'm just gonna roll with it. Okay, you guys.
There is, however, one overriding factor that I believe underpins all overfilling, and that is filler longevity. We've all been led to believe that temporary hyaluronic acid fillers last from 6 to 18 months. However, in January 2021, Dr. Mobin Master published an article in the Plastic and Reconstructive Journal about filler longevity that showed fillers may last a lot longer than we commonly believe. Using MRI scans, he found that of 10 patients who had filler more than 2 years ago, all 10 showed persistence of the filler longer than 2 years, including one lasting 12 years.
So we have to think about the long-term implications of things that we can't really erase, even though there is something called a beauty eraser. I'm gonna flip through these things. A lot of people dying in the name of beauty.
All right. So what do you think of that? Pretty eye-opening, right? Drop anything in the chat if you have questions about any of that stuff. But to me, this is really eye-opening. This is really troublesome. The aesthetics world right now is utilizing fillers. They're utilizing Botox at rates that are unprecedented, have never been seen before. And frankly, a lot of our population looks completely fake. They look like, Barbie, and they expect to look like Barbie and look at plastic until, they're 89 years old. And to me, that is completely unnatural. And, we want to be healthy. We want to be natural people. We are going to age. It is not normal for a 70-year-old person to look 25. And I don't think that, in society, people aren't going to recognize, they recognize the confusion more than the health of people. So we added these services to just help give people a great opportunity to be absolutely as healthy as possible. Okay. So this is one of the services that we've now offered or begun to offer, and we've been getting really, really cool, amazing results with this. This is Morpheus 8. This is amazing technology, uses radio frequency microcurrent, and allows the body to heal and reduce wrinkles and fine lines on its own. It actually makes the skin healthier. So we're gonna watch this short little video, and then I'm gonna let Kira take over for us. All right, Kira, I'll let you take the reins here.
Yeah, sounds good. So kind of like Trevor said, we're going to start with one of the services that we offer, which is the Morpheus 8. Very popular. What it is it is microneedling with radio frequency, and we can go at different depths. So these little pins are gold plated with heat, and we're able to reach up to 4 millimeters on the face, and we can go even deeper on the body. So you can do the face or the body, and it's able to reach that subcutaneous layer as well as the dermis, and then the top layer is the epidermis. So it's a really cool thing. Like Trevor said, it causes these little micro injuries that cause this wound healing cascade. It basically tells your body, oh, something's happening. We need to draw attention there. And in turn, it results in neocollagenesis, which is new collagen, fat remodeling, because we're able to get to that deep layer to melt some of that fat, improve elasticity, reduce those fine lines, wrinkles, and acne scarring. And that's really just to name a few. So with the Morpheus 8, to get optimal results, we like to do 3 treatments about 6 weeks apart. And the cool thing about Morpheus 8, it might take a while to see results right away. Sometimes, as you'll see in some pictures later on, people see great results after 1. But we do tell people, be patient, because your body continues to work for months after your last treatment. So a lot of times we say, if you don't see anything, 6 months down the road from now, you could be seeing great results. Another good thing about the Morpheus 8, it's great for all skin types, all skin colors. And then one other thing that's really cool is they just came out that the Morpheus 8 was the first and only FDA clearance for soft tissue contraction for fractional radio frequency microneedling. So there is science behind this. Trevor sent us nurses to LA to learn more about this. And even though we're not doing plastic surgery or anything like that, a lot of the top plastic surgeons that work with celebrities are utilizing these exact treatments to treat them because it works, and you don't need all of those other things to see great results. So dang it. So I just want to walk you guys through exactly what to expect when you come in. So with all of our treatments, you're going to have a consult. You book a consult so you can sit down with me or one of our other nurses and just go over what are your skincare goals and what do we have to help you. And then we'll go over just your basic health history. Do you have any allergies, anything that we need to talk over? We'll go over this picture here is just a before care guide. We like to set you up for success. We want to make you feel comfortable before you come in. So we gave a list of do's and don'ts before the procedure. So we'll go over that just so you know what to expect. With the Morpheus 8, really, if you've had Botox or fillers, you can still do this, but you need to wait 2 weeks before or after Botox. And if you've had fillers, we really need to wait 6 months because of those. We cannot do Morpheus 8 on damaged skin, so we want it to be healthy. So you need to protect yourself in the sun, stuff like that. It's kind of like you want a nice, clean, or healthy canvas to work on. So then we'll just sit down. I'll answer any questions that you might have. And then when we're done chatting, if it's something you want to go through with, we'll book your first appointment and we'll make sure to follow up with you so you're feeling comfortable before you come. And then the day of the treatment, kind of what to expect. So we like to take before pictures just so that we can say, okay, this is what you look like before your first treatment. We'll do another one after. Sometimes it's like, oh, I don't know if I notice anything, but then you see those before and after pictures and you're like, oh, that's actually more than I realized. So we like to always do those so we can compare, okay, this was their first treatment, this was your last treatment. Look at the progress that we've made. We'll put some topical numbing cream on for an hour. So during this time, you are more than willing to work. You could read a book, just rest. We do have IV therapy here, as Trevor mentioned earlier. A couple of IV drips that are great for skin health is our high dose vitamin C and also our fountain of youth. Those are really great for healing as well as just overall skin health. Then we'll go and take off the numbing cream. We'll clean your face, use some alcohol so it's nice and clean before we start microneedling. Microneedling, Morpheus 8, it can be kind of a painful procedure. We've had people do it without this Pronox. We've had people do it with it. We did decide to bring on the Pronox just because it makes it for a more comfortable procedure. And so what Pronox is essentially laughing gas. If you go to the dentist, it's 70-30 concentration of nitrous oxide and oxygen. And in our office, it's 50-50. So the nice thing about that is it wears off real fast. You can actually drive home 15 minutes after you take your last breath of the Pronox. And it makes a world of difference. People have such great things to say. It just makes it overall a better experience for you. So we wanted to bring that on. You will be red and inflamed after. That is totally normal to expect a downtime of about 1 to 7 days. Depending on what all the treatment entails for you and what you decided, you may have these grids with the top layer of skin that may take 1 to 2 weeks to go away. So post-treatment care when you're in our office, it's just so important. We decided after researching different skincare lines that we wanted to go with AnteAge here. AnteAge is very familiar with the Morpheus 8, and they actually have protocols for what to put on post-treatment, and we decided to go with those in our office. So that is what you will see us using after, as well as I'll go over, we'll send some home with you as well. But we also discovered as of late the awesome product that they offer, which is exosomes. So exosomes are derived from stem cells, and they are basically your skin's little messengers to your cells saying, okay, this is what you need to do. You need to heal, you need to rebuild collagen. It kind of wakes your cells up to do what they need to do, and it will optimize your results and enhance the regeneration and anti-aging pros that come with this treatment. So we have some really cool before and afters of a staff member of ours that we did not have the exosomes yet. And so in that first picture there, you'll see 24 hours without exosomes versus 24 hours with exosomes. And it was crazy, the results that we have been having, not just with her, but with multiple of our clients that have decided to utilize the exosomes post-treatment. Well, they would say it's well worth it. It minimizes the downtime, decreases the redness, the inflammation. It's normal to expect your inflammation to peak at about 72 hours, and then it kind of goes down from there. So those are just some things to expect, but we've also had people that have had minimal downtime. It's just totally dependent on the individual, how exactly you're going to respond. But we also look at it as if you're inflamed, that healing process is happening and it's okay. And we're here to we'll follow up with you, walk you through it. but these exosomes have been a total game changer in this downtime. So post-treatment instructions, once you go home, again, we'll send you home with these. We will follow up with you. So for 24 hours, all of those microneedling channels in your skin are open. So we want to treat your skin with care. You're not going to want to be in the sun. You're just going to want to just kind of chill and relax. And utilize some of these skincare products that we will provide you. We'll give you step-by-step instructions, what you do night one, day one. We will gift you with purchase with the AnteAge products that we want you to use post-treatment. Now, you don't have to use them if you choose not to. That is totally up to you. And again, you'll want to schedule 3 treatments, 6 weeks apart for optimal results. So let's talk about what all the Morpheus 8 can do for people. So probably the most common thing people talk about is the double chin. They always go, I could get rid of this. And so as you'll see in these pictures, like it does skin tightening. Like I said, we get into that subcutaneous layer and it helps target that fat and the heat hits it and we can help minimize that. And it's really cool. It can get the sagginess and bags under your eyes, help lift that up. The crow's feet, everything we can do, abdomen, your back, really anywhere. A lot of people want to do the wings on their arm and their tummies after maybe having some babies, might have some stretch marks, a little bit of, you've lost some elastin and stuff like that. I also want to hit on that. The Morpheus 8 is also great for age prevention. And so one thing that we learned when we went to LA is if you're between 35 and 55, that is prime time for collagen regeneration. Now, if you're outside of that window, getting up in your 60s, 70s, it's not that you can't see results. It's just your collagen might not bounce back quite as fast as you would between 35 and 55. And if you're not 35 yet, it's still a great thing to do for age prevention. So yeah, pretty cool results. And again, I'm hoping that we'll get our own pictures. We just started rolling this out here in May. So as we continue, we'll get some of our own pictures here as we go. But that was just to give you an idea of what it can do. Sorry, you can go back. You're on mute, Trevor.
Why don't you repeat that last probably 30 seconds when the music was playing? We couldn't really hear you.
Oh, okay. Well, I was just saying that Morpheus 8 is also great for was I talking about age prevention, 35 to 55?
Yes, we did hear you say that part, but just right after that.
Oh boy. Okay. Well, I think I was saying something along the lines of if you're outside of the window, it's still great for you. Oh, yes, that's what I was saying. Before and afters. We just started rolling out these services in about May-ish. And so those pictures, I can't claim those as ours, but that was just to give you an idea of what Morpheus 8 can do for you. So hopefully, you know, with our services continuing to go, we can get our own before and after pictures. Okay, so on to our second service, which is Lumecca. And this is easily one of the favorites because it gives almost immediate results, which is really satisfying to see. I know us nurses really enjoy this one because it's really cool. So what is Lumecca? Lumecca is a powerful, intense pulse light therapy to treat pigmented and vascular lesions anywhere on the body, so head to toe. You see significant improvements even after a single treatment, which I have a really cool before and after here in a little bit. Helps with skin clarity and complexion. It's also known as kind of the photofacial because it just gives that overall such a nice, even skin tone. I love this picture because it just really captures it, the even skin tone and clarity that it brings. So in just 1 to 3 sessions, we suggest 3 for optimal results. It can improve appearance of age spots, those vascular lesions, so any sort of red, bluish tinted little vascular lesions at the surface, rosacea, freckles, any sun damage spots. The only downside to this is it's only good for skin types 1 through 4. So that would mean if you have Eastern Indian descent or African American, unfortunately, it just is too high of a risk for burning for those skin types. So what to expect? Very similar to the Morpheus 8. You'll have a consult with us. We'll go through your goals. We'll see what we can do for you. We cannot treat recently tanned skin. We need to, if that's why a lot of people take a break in the summer months. If you're going to be in the sun, we highly suggest sunscreen just for the sake of preventing burning and scarring. Minimal discomfort kind of feels like a little bit of a heat zap to your face, but it's really quick and overall not too bad. Our clients don't really complain of much discomfort. Like I said, you'll see immediate results. If you got dark sunspots or those freckles, they will literally darken before you leave that day. It is so cool. We have brightening exosomes as well, and those are very similar to the other exosomes. They just have extra components to it that help overall brighten your face. Again, optimal results, 3 treatments, and those are about 4 weeks apart. Post-treatment instructions, there really aren't many. Again, you'll want to protect and care for your skin as it heals. You can wear makeup right away after. As those spots come to the surface, we just say try not to pick those. They will just eventually slough off. And we also have a brightener. Some people really struggle with melasma and some age spots and stuff that we have AnteAge brightener that can just help in between treatment to optimize your results. So this is Kiesta. She is comes to see us frequently. She is actually Mrs. North Dakota International. And she took these before and after pictures, and this speaks to it fully. I mean, on the left there, so I just want to make sure you know that on the bottom there is the before and the top is after on the left there. And just though that is what to expect. If you've got freckles or spots, when you leave and over the next several days, those spots will get darker and eventually just slough off. And that last picture on the right, and how bright her face looks, that is, I would say, a realistic result for this treatment. These are not our pictures, but it gives a good example. This gentleman on the left really suffers with rosacea after 4 treatments, how great his skin looks. And I wanted to show this picture up here because she's got sun damage spots, but also those surface vascular lesions on the top. They're like almost little red spider veins. We can zap those and they will a lot of times go away right in front of our eyes. So, and last but not least, we have Diolaze here.
Diolaze XL by InMode uses an 810 nanometer diode laser to effectively target and treat hair for safe, fast, and permanent hair reduction. When used, the diode energy penetrates to the root of the hair follicle to heat and disable its growth. Comfort, efficacy, and speed are key to Diolaze XL's hair removal success.
Okay, so again, you'll have a consult with me. And I don't know if I mentioned this, but consults are free. So I just want to make that clear. You just sign up and we'll talk through your goals. Again, unfortunately, due to risk of burning, we don't treat recently tanned skin. So a lot of people will start this as we enter fall here. Minimal discomfort. Now I say that you can take, some of you may have had this before, but it is very quick, a little almost rubber band like zap. Some areas would be more just uncomfortable. The bikini areas maybe a little bit more spicier than others, but overall it's very fast and minimal pain. And we usually just chat and try to distract you through the whole thing, and we get to know each other pretty well. So mild redness to the area. We can see the hair follicle kind of comes a little black speck, kind of comes to the surface. There might be a little mild redness there, but by the time you leave it, it's likely mostly gone. You'll see, I was blown away by this treatment. I didn't think people would see great results after just one treatment, but we actually have seen phenomenal results after one treatment. I think it's 100% people have come back so far very pleased after their first treatment. So you purchase a package of 6 and we give you 8. If that makes sense. We just want to make sure that you're happy with your results, and by 6 to 8 treatments, you should be pretty happy. Post-treatment instructions, again, protecting skin from the sun is the big one. You cannot wax or pluck within 6 weeks of treatment. Hairs can get trapped, so you'll want to exfoliate that area about 5 to 7 days post-treatment. And then you'll want to schedule your next appointment. So the first 3 sessions are likely going to be about 4 weeks apart, and then based off hair growth, we space them out from there. So this is for all 3, the Morpheus 8, the Lumecca, and Diolaze. Just some contraindications that we try to follow. Now, if you have any of these conditions, it doesn't rule you out. We will just sit down in our consult and talk about them, but we just let you know. We're pretty careful with skin cancer. We won't go over any of that. If you've been free of skin cancer for a while, that's a different story. But a lot of times, if you're unsure, you can go to a dermatologist and just make sure. But obviously nothing's been tested for pregnancy and nursing. Any sort of autoimmune diseases that is going to prevent your body from healing the way it should is something that we would also talk about. Accutane, it really dries out your skin. It leaves you for a risk of burning. So that's a big one. You have to be off that for 6 months. And I won't go over all of these. We'll go over these in your consult, but we can't go over tattoos or permanent makeup or anything like that. Okay, so this is a little bit different, but I did want to mention it because it is another aesthetic service that we do offer. A lot of you might be familiar with PRP facials or the vampire facial. So we do that. PRP, we draw your blood and then we spin it, and it leaves us with platelet-rich plasma, which then we use alongside of the skin pen, which has also great benefits to it. You can decrease fine line, wrinkles, acne scars, stimulate that collagen and elastin regeneration and overall complexion. So the difference between, obviously this isn't going to be we can go at different depths, but it's mostly going to be that epidermis, that top layer of your skin, and it will leave you with a great overall glow. The downtime's about 3 to 5 days. You do have kind of a sloughing peeling after this, which we haven't seen so much with the Morpheus. So the other cool thing with the skin pen is if you didn't want to do the PRP. So one cool thing somebody told me one time is, since the PRP comes from you, if you're 65 your PRP is going to be about that of a 65-year-old. So it's as good as the age you're at. So the nice thing about exosomes is if you're wanting to use something that's going to maybe help your body age a little bit better, exosomes might be better than your own PRP. So that's something that we could also talk about. Okay, so let's get to the nitty gritty of the specials here. So we are actually having a fall bash next month. And I'll talk about that in a little bit, but we decided, we're like, what can we do for these people that have attended the webinar? And we decided we would give you our fall bash specials early. And so we want to give you buy two, get one free of the Morpheus and Lumecca. And then that would also be, so that would be on that. And then Diolaze would also be at that 33% off. And so if you have any questions or comments on that, please feel free to ask us. And then we also wanted to add a little incentive to get your consults booked. And so if you book a consult by September 1st, it doesn't have to be scheduled before September 1st. But as long as you book one by September 1st, which is coming up, which is crazy, you'll receive a free fountain of Youth IV with a purchase of $1,000 at your consult. And that IV is a value of $250. So something to consider. Also, we'd love to have you regardless at our open house. Grab your friends. This is actually just a really fun event for us and our staff. We're gonna have some drinks, some food. Again, we're gonna offer that exact discount that we're giving you here. We'll have giveaways, some education that I've talked about tonight, and more. You can kind of get your hands on the services, see it firsthand. But we would honestly, it's just fun to see people come through our doors and share our new services, and so we really hope to see you there.
And I will tell you, if you're wondering, man, why would I want to take advantage of this before maybe this fall bash? Part of the reason that we are offering this to you now is because, frankly, if our fall bash, like, we're expecting a lot of people to be there based on our previous open houses and stuff that we've done, and so our consult schedule may fill up. So it would be a good opportunity for you guys to go ahead and get in. Take an opportunity to get this scheduled before everybody else tries to get in.
So if you are interested, we are open Mondays through Thursdays, and we will, Trevor, do they start taking calls at 8 or 8:30?
8 o'clock.
So they will be able to answer your phone calls from 8 to 5. And so you could start calling tomorrow to get these booked. And again, it is free. And so I would love to meet with you, and we could go through some of the things that you've learned tonight and just basically look at what your skincare goals are. Everybody's got them. They come to me almost every day that I'm working, and they're like, can it do this? And can it do that? And chances are we do have something that could help you. And one thing that I personally just love about the services that we have is, when you're doing Botox, it's such a quick fix. It's very similar to the goals of functional medicine and looking at the root cause and not doing a quick Band-Aid fix. Botox is a quick fix, and it does not leave you with permanent results. And so our services are a natural way to tell your body what it needs to do and to hopefully give you more long-lasting results that aren't just a quick fix. So
Yes, perfect. So Kira, we do have a couple of questions here in the Q&A, so I'll just read them out loud and I'll let you answer them. So first one is, sorry, my audio cut out. Is it buy two, get one free plus the 33% off?
nope. So it'll be on Morpheus 8 and the Lumecca, because we ideally want to do 3 for optimal results. It's buy two, get one free. And then the Diolaze is just in packages. So the hair removal packages are then 33% off.
Yeah, so basically what we wanted to do is we wanted to be able to offer buy two, get one free for all the services. And so either way you look at it, it's 33% off. So Kira, how long does the consult take?
So we usually book them for about an hour, but I would say that just because we don't ever want to feel rushed through them. And then the nice thing is if our nurse on the aesthetic schedule has time and you wanted to do a Lumecca or a hair removal, there might be time at the end of the consult to do that. It's not guaranteed, but it is something we do if we have the time. We unfortunately cannot do that with the Morpheus 8 because it is quite the treatment. So it takes a little bit more time.
Okay, next question is, do we pay for the services at the consult or when we get the first treatment?
At the consult. So we'll go over all of that at the consult. We have different packages. I kind of hit on it a little bit and I can elaborate a little bit more, but the Morpheus 8 has so many I guess you could say add-ons. So it comes with your basic tip, but then we have other tips based off what your goals are. So we have the main tip that is a 24 pin, and then we have a prime tip, which is a 12 pin, and it allows you to get closer to around the eyes and around the mouth. And then we have the resurfacing tip, which is the gonna get the top layer of the skin. And so those are all things that I talk about through our consult. We've put together packages, which includes all that we think you might need, and we discount those as well. So these are all things that we go over in our consult, but then you will at the consult decide what you want to do and ideally pay before your first treatment.
All right. And is there a list of how much each service is before the discounts?
Yes, I do have that. We have it here at the office as well. So I can just kind of tell you, and we can go over this too if in a consult, but your face and neck for a single is $1,250. So for two, it's $2,500 and you'd get the third free.
And what we can do, if you're interested in any specific services or if you have additional questions, we can also email you the price list. We have it here at the office. Encourage you to email us at frontdesk@valleyvitalmedicine.com and we can definitely get the price list over to you. And then you can let us know what additional questions you have. Okay.
Yeah, there's a lot of, like I said, you can do the Morpheus 8 anywhere. And so we have quite a lengthy list of prices from a head to toe area. So it'd be hard to go through all of them for you, but.
Yeah, and keep in mind, Kira and the other nurses, their goal is really to individualize this for you and make sure that your goals are being addressed. So even though we have a price list, you know, it may not be totally applicable to you. It's more of a general guideline for us just because we may be doing something specifically for you based on your goals, your history, and those kinds of things that that's probably going to be different than the next person. So that is the entire point of doing the consultation. Okay. And then last question that we have right now is, can I use my HSA card for these services?
Ooh, that'd probably be for you, Trevor.
Yes, we should be able to do that. So we utilize HSA cards for the services that we offer here. So if you have specific questions about that, feel free to talk to our front desk and we can definitely make sure that it's applicable for you. One other question here that just came in. Do you recommend the Pronox for only the Morpheus?
So it is included in the Morpheus. Like we do not charge extra for that. We have yet to have somebody ask because the other ones just they don't feel like they need it. And I definitely would say that you can. There would I think it's a $75 charge if you use it for a different service, but you certainly could.
Yeah, absolutely. Yeah, it's completely safe. It gets out of the body super fast. And we've seen great results with it. So, even if somebody just has maybe a little bit of anxiety about one of the services for whatever reason, the Pronox can be a great way of addressing that too. So, feel free to talk about that as a part of your consultation as well. And we do have it right there as well as part of while the treatment's being given.
Yep.
And so if you get partway through your treatment, you decide that you would like to start with it, then it can be initiated at whatever time you decide. Another question came in, says, what is the difference between Lumecca and BBL, or is there a difference?
So I actually was just doing a little bit of research on that, and my understanding is the wavelengths, it's a different technology. I've never done BBL, so I can't with 100% certainty speak to that, but my understanding is Lumecca is specifically geared toward targeting pigment. And so it is going to pull those areas of color, whereas BBL has a different technology that I think overall helps skin health on a different level. So I'd have to look a little bit different, but they do not do exactly the same things. Similar, but
All right. Any other questions here as we're wrapping up here tonight? I'll give another minute here for people to type in if they have questions. Do you use local anesthetic to numb the face before laser treatments?
laser treatments or
Right.
the Morpheus?
The laser treatment.
We don't, and we have not felt like we needed that actually. People have had, I've done both, and I feel like they're both not too bad. Yeah.
Yeah, it really hasn't been necessary for the people that have come in and done the laser treatments. I've done the IPL myself, and it's really not bad. It feels like you're getting snapped by a little bit of a rubber band. Very tolerable, and it goes really, really quick. We got a comment here. Great information. Thank you so much for your comment. We appreciate it. This is all about just information here. One more. Does the hair removal remove all color of hair?
Good question. So unfortunately, it has to have color. So no peach fuzz, no gray, blonde won't do anything, and red tinted hair does not take very well. So people that have dark hair are our prime candidates. But there's, I mean, depending, even blonde people in certain areas, as long as the hair is dark or has a darker pigment to it, it will respond great to that. So good question there.
Thanks, Kira. Next question is actually addressed to me. It's asking about, is the MTHFR variant a concern with the nitrous? So one of the things that I did when I looked at bringing in the Pronox was the safety of this. So one of the things when I was doing the research is there have been millions of these procedures done, and it is so safe that you actually don't even need to have any sort of monitoring for somebody who is utilizing this. There haven't been any negative effects of any sort, and because of the low level of concentration of it, people just do super well. And we have utilized it on some people that are really just quite sensitive individuals, and they've done super well with it. And so I guess I personally don't have a concern with any of my clients utilizing this, no matter no matter their physiology. So just because of the makeup of it and the low level of concentration of it, it really does get out of the body really fast. Kira, another question here. If we book a consult, do we just mention that we attended this for the discounts?
Yeah, we have a list of everyone that signed up, and honestly, if you just mention it when you call, they'll just make a note of that in your consult, and we'll make sure to get you that discount.
All right. Got a Another comment, wonderful presentation. Thank you for sharing that. What was the email for the price sheet? So please just email our front desk at valleyvitalmedicine.com, and we'll make sure that the price sheet can get emailed back out to you so that you know kind of what that looks like. One more question here. Do we have any peptides or IV injections that can help with the skin? Yeah, absolutely. And we certainly can talk about that. You know, one of the things that we try to do is we individualize everything for everybody, depending on your goals. So IVs and peptides can definitely play a role in that. Specifically, glutathione is super great for the skin, helps with brightening. In fact, many people will just do IV glutathione for skin brightening. And, you know, the frequency of that generally is going to be like twice a week for a month, and then kind of reevaluate, are you happy with the results you got? And then you can consider doing it again. You know, the peptides themselves, there's so many different ones. So we certainly can talk about that and talk about your goals and where we can source those for you as well.
Yep, the Fountain of Youth IV I mentioned earlier that you'll get if you book a consult by September 1st and purchase. The glutathione gives the name Fountain of Youth because of the awesome skin benefits that it has. So
yeah, 100%. Can I invite a friend to book a consult to get the discount too, or do they have to watch this webinar? So we have almost 25 people that were registered for this webinar. So you don't have to be live. We're going to send this out. If you want to share this deal with a friend, you are more than welcome to do that. We're not going to only hold it for the people who are here live. You know, Kira mentioned that we're giving the same benefit as it for somebody who comes to our fall bash. But we encourage you to take advantage of getting in on this sooner, just because I'm afraid that some of these services are going to fill up and it's going to be harder to get in for the consults. So now would be a good time to do it. And yeah, so this is available for anybody. Share with family, friends. I'm also going to share this recording on Facebook as well. So, you know, anybody who watches this or wants to get started with it certainly can.
and even if you book a consult, bring your friends to the party. We want to see a full house, and it really is just a fun thing to do. And so we're excited. All of us staff love doing this, and we want you to bring your friends and enjoy it too. So
absolutely. Amazing. Got another thank you for the great presentation. Kira, you did a fantastic job tonight. I am super proud of you, super impressed. And so Kira has been such a great asset to us here at Valley Vital Medicine, and also all of our other nurses and staff. I want to give a huge kudos just to everybody who's here. We at Valley Vital Medicine would not do what we do without the amazing support people that we have between the front desk, the nurses, technicians, and we added another nurse practitioner just today. So without all of those people, we wouldn't be able to do what we do. So I want to give everybody a huge kudos and huge shout out. Thank you so much for being here tonight. I can't believe like pretty much everybody who started a webinar is still here live with us tonight. And so Kira, that just gives a huge shout out to you that you've just done a fantastic job. So any other last questions or anything here before we go tonight?
thanks for joining us, guys. It really is fun when people are excited about what we're doing. So hope to see you at a consult.
All right. Have a great night, everybody. Thank you.
Bye-bye.